Well, thank you, Madam Speaker. And as always, I'm honored to be here in this place and talk on behalf of the members of North Island Powell River. And I'm really sad to be here today, and I never thought that I would be sharing concerns with the House of Commons that constituents of mine are now afraid because of the total lack of health care. The federal government has paid less and less into healthcare transfers, and provinces and territories are struggling. We knew, and it's been talked about in this country for a very long time, that we had a raising and increasing population of people who are aging, that there is challenges in recruiting and retaining healthcare providers, and we still do not see any meaningful action from this government. I have spoken about this issue before in the House, and I will continue to do so because we are in a significant crisis, and people in my riding are paying the price of that crisis. I receive emails and calls from remote communities in my riding daily. Port Hardy, Port McNeill, Alert Bay, especially because their emergency rooms are being closed far too often. Madam Speaker, all night long, emergency rooms closed. That means if anyone has any serious health issue, they have to travel quite a distance to get where they need help. And if you live in Alert Bay, you're on an island, so that is even more problematic. Madam Speaker, just last week, a constituent having serious health issues got themselves to the Port Hardy hospital. They arrived, and upon arrival found out that the emergency room was closed. And they collapsed. An ambulance was called, and they had to take them to another community to be served. Closures of emergency rooms are directly linked in our riding to a lack of staff. They are tired, they are burnt out, and they are leaving. And the federal government must stand with its provincial counterparts to support strategies to both attract and retain healthcare professionals across Canada's rural communities. It is not sustainable in what's happening right now, and it is not safe. Constituents are sharing stories of having to travel a long distance to get basic care. This cannot continue. Recently, an article came out about rural communities and pregnant people having to travel a long distance to get the services that they need. And when they do so, Madam Speaker, the pregnant person is paying out of pocket to have a place to live and something to eat. And often they are left alone because their spouse or partner is back home looking after children or working, doing the things they need to do to sustain the family. One of those people who shared their story was from Port McNeill, Darcy. She told a terrible story of being left alone, missing her partner who was doing everything he could to support her, and finally having the pregnancy, the birth, without her partner. This issue is long-standing, but we're seeing it across the board, an increase of closure for so many services. For example, in Powell River, the hospital lab is closed many days due to a severe shortage of staff, which means that outpatients are arriving, finding it closed, and we know that overworked staff, exhausted lab staff, are ready to leave and looking for other opportunities. We also know that doctors, nurses, healthcare professionals across the board, exhausted, tired, wanting to leave. And we don't have a meaningful attraction strategy to bring newcomers and other folks from across Canada to be in our communities. I want to thank so much the Citizens for Quality Health and other healthcare advocates from North Vancouver Island and Powell River who have been warning about this for over 3 years. Before the pandemic, Madam Speaker. This is serious and it needs to be addressed.
The Honourable Parliamentary Secretary to the Minister of Health.
Merci, Madame la Présidente.
Thank you, Madam Speaker. And I'd like to thank you for this opportunity to discuss this very important issue.
Across all areas of the health system, but they're particularly clear right now in our hospitals, and it's harder to watch as children are affected. Understaffed emergency rooms have led to long wait times and even some closures. Notre gouvernement collabore.
Our government cooperates with provincial and territorial governments, as well as key stakeholders, to find an immediate and long-term solution to meet the need for healthcare personnel.
This spring to better understand the challenges facing the health workforce, and we are currently engaging with stakeholders to refine and align solutions. I'd also point out, Madam Speaker, that over the last 6 months, the prime focus of Health Committee, on which I serve, has been the human resources and healthcare crisis and we've been studying how to remediate this challenge, and literally nothing is off the table. Rural communities, like the one that my colleague serves in, require unique solutions to their healthcare challenges, and that's why our government is providing $26.2 million in funding to increase the forgivable amount of student loans for doctors and nurses who would like to practice in rural and remote communities. We've also committed $115 million over 5 years, with $30 million ongoing to expand the Foreign Credential Recognition Program, which will help 11,000 internationally trained healthcare professionals per year get the credentials recognized and find work in their field. Madam Speaker, my colleague opposite raised the point. She said that we're not doing anything to help people come into the healthcare sector. She says that we're not doing enough to attract foreign credential qualifications and recognitions. Madam Speaker, we're investing tens and hundreds of millions of dollars in these areas. It is a prime area of focus. Il y a encore beaucoup à faire.
There's still much to be done, and our government will continue to work with the provinces and territories.
With provinces and territories and experts to find ways to recruit new healthcare workers and improve working conditions to retain and make better use of our existing health workers.
I'm looking forward to working with my colleagues in the provinces and territories in the coming months and weeks so we can work on this file. Thank you very much, Madam Speaker.
For North Island Powell River.
Well, Madam Speaker, I am very concerned to hear again another, let's have a round table, let's have a conversation, let's do the talk. We need action in our communities, Madam Speaker. Rural and remote healthcare is hurting because of many specific challenges. I'm happy to inform the member. Finding a family doctor is getting harder and harder. Accessing walk-in clinics harder. Waiting too long for much-needed surgery in rural remote communities, long-term challenge. Delay in medical test results and other medical services due to a lack of medical personnel. Harder to attract people to rural and remote communities. That needs to be addressed in a more profound way. Having to travel very long distances outside of their community to access regular and specialized medical services. Very hard on families, Madam Speaker. Having seniors waiting for long-term care, often in the hospital because they can't get into a long-term care facility, and a complete lack of mental health services that are comprehensive and support people in my riding. So I'm calling...
Honourable Parliamentary Secretary.
Madame la Présidente, je vous...
Thank you, Madam Speaker. I'd like to thank my colleague for raising this issue, which is very important.
Facing an unacceptable shortage of health workers, our government will continue working on addressing the shortage as well as improving health care in rural areas generally. The needs of Canadians in rural and remote areas are foremost in our minds as we work with provinces and territories in the coming weeks and months to improve our healthcare system, Madam Speaker. But we mustn't cherry pick from the list of things that I mentioned tonight. You know, we are creating solutions across the board in staffing, in solutions, in healthcare transfers, for the pipeline, for education. No stone has been left unturned, and our health system needs further investment, but we also want to make sure that our tax dollars are being spent in the most effective way possible. Throwing more money at a broken system is not the best path forward, and we can improve the way that we deliver health care to eliminate inefficiencies and get better health outcomes for all Canadians. Thank you, Madam Speaker.